Hello and welcome to Avasant's Digital Forum, a guide to healthcare's evolving platform market, creating value through transformation. This is the second session in our three-part series, A Guide to Healthcare's Evolving Platform Market. This series is in partnership with Infosys. My name is Andriana Albert and I'll be your MC today. Avasant is thrilled to have partnered with such an innovative organization to bring in our thought leadership and expert insights to our audience. Thank you again to Infosys for your partnership. As we aim to make these sessions as interactive as possible, we encourage you to utilize the chat and Q&A features on your dashboard to pose questions to the panelists. They will be answering your questions live throughout the session. It is now my pleasure to introduce you to today's moderator, John Walters. John is a principal advisor and one of Avasant's healthcare leads. John, welcome and thank you for joining us.
Thank you so much, Andriana. It's a pleasure to be here, and hello to everyone. We appreciate everyone taking time from their schedules to participate and listen to this call, as we know there's a lot of things, a lot of competing agendas. So much appreciated. I wanted to do a couple things just to get us kicked off here. If we can go to the next slide, please. I want to just give a little bit of background. I mean, this is stuff that everyone knows in terms of technology's ability to impact healthcare in a positive manner. There's some statistics that commonly get mentioned, such as the amount of money that we spend on healthcare. You can see in the note almost 20% of US GDP trending towards almost $4 trillion annually. So, it's a big number that is trotted out there. The other thing that's really impacting the cost base today is the fact that there's over 140 million people who have been diagnosed with at least one or more chronic diseases, such as heart disease or asthma or cancer. And so while these diseases aren't necessarily, if you will, curable, they can be the circumstances of these diseases can be significantly mitigated with the right kinds of plans. And so there's a lot of things that are contributing to these cost points. But then I think we also see that there is some light at the end of the tunnel, if you will, that the technology companies that work in this space are starting to respond to these needs. You can see that we're starting to put the patient at the center of these healthcare discussions, and we're using the data that can be delivered through better interoperability and better data exchange to try to identify these diseases closer to the onset, in some cases even delay or eliminate the diseases altogether. And so these tests and tools and remote technologies, digital healthcare sometimes called, are really starting to take their place in the healthcare value chain and are starting to deliver on their promise. There's just a few things that we look towards, when we think about how's technology going to impact the future of healthcare going forward. I think as we look at the hospital systems, we think that these will become more and more virtual and less physical, that they will start centering around patients as opposed to just ambulatory care and or hospitalizations. And that the health plans themselves, who have access to most or not all of the data from EMR systems and claims processing systems, will be able to process that data more easily. We'll have the right kind of tools, the right kind of artificial intelligence algorithms to really attack and go after that data that will be developed, that will be enabled by interoperability. And then I think the last sort of factor that's weighing in is the advancements of the medical devices. And you're seeing the sort of Moore's law, if you will, being applied at even an accelerated or exponential fashion to devices being shipped from Apple and from Google and from GE and other companies. So these are developing quickly, becoming more and more user-friendly and easier to deploy. So these are just some of the things that are impacting our discussion and impacting technology in today's environment. Next slide, please. Okay, so we're doing a three-part series on platform implications and how tech is supporting the insurance and the sort of integrated payer and provider models that are emerging today. In the previous discussion, we talked a bit more about operating the platform and how accuracy and getting the right enrollment functions and claims processing is important. In this session today, in number 2, we're going to talk a little bit more about optimize, how systems are evolving, how automation is kicking in, how analytics and AI will have an impact on the technology stack and the business models. And then in a future session, we'll deal with growing the member base and geographic expansion and those kind of things. So, see, next slide. Okay, this is just a slide that we've used for reference perspectives. You can see that there's a lot of major platforms that are out there in the healthcare space, and then also other platform technologies that are evolving that are a little less comprehensive. So we may refer back to this, this sort of timeline and the evolution of healthcare platforms. With these are a little more focused in the payer market as opposed to the provider market. So I think I think we're ready to move on, and I'm going to turn it over. I'm going to skip this slide for now. We'll come back to this. I'm going to turn it over to Moderator from Infosys, who's going to give a little bit of a demo today.
Thank you, John. Thank you for that introduction. And we can move to the next slide. So, from the point you were making, John, with regard to the core admin platform and the inefficiencies that are built into various processes that go into running a health plan, and how technology and the next generation products and platforms are evolving to remove some of those inefficiencies. To make the case, I just picked, one business functional area for today, which is largely the the product configuration and the plan sponsor onboarding. And I picked, through our consulting consulting services experiences, I picked some 4 different examples to just talk through in terms of how intensive these initiatives are for the payers. The first one where we did the big data-based large group rating system. The organization here was looking to reduce the time it takes to do the rating or the review of the rating. And there was a large cycle time involved, and we're going through a variety of approval processes. And so we built a data mart that enables those review decision points much quicker. And this was going to be used for both large and national accounts in the fully insured and ASO business. The second one is a national payer where we developed them. This is a homegrown custom application that we developed to do the plan sponsor intake after the plan has been sold. And there will be a set of documents that come out from the the sales executives, and the plan sponsor intake process takes those and keys into the system so that it can be pushed forward from the benefit coding and the case install or plan install. And this itself involves roughly about 300 to 400 users doing this job on a daily basis. And so this is again both for the mid-market and the national accounts, cutting across medical, dental, vision, and pharmacy benefits. Again, a very, very important key function, because if you key in something wrong, only way to know that is when the adjudication is not going through accurately, or if there are way too many pending claims. So that's the another, a very siloed function in the product configuration or the plan sponsor onboarding. The next one is somewhat very interesting, because whenever there is a group that is looking to switch, the prior data is not in the curated form that you can accept straight in. If you take it in, the health plan used to spend almost 6 to 8 weeks just to take the data in, because of the volume and because how it was laid out. And over the last few years, there has been quite a bit of standardization that has come in, but still it is not at the level. Again, so this was something where we built the integration to an external vendor who could do that for this payer. Now imagine the spend going into this process. From the grand scheme of things, it's not a value-added activity at all, but there was a significant spend just to support that. The lastly, which is a mid-sized payer who was, this was about 3 to 4 years back, I would think, trying to automate their group enrollment process. So they were using a very well-known CRM product, and that's the one they were using for the lead management. And when the lead closes, they are trying to do it on, load up that plan sponsor onto their core admin. And when we built the interface, because of the, the data structures were so different, the success rate of a successful plan sponsor load was only about 30 to 40%. The rest all, you had to still go into the core admin and key in all those data elements that was required to do the downstream processing. So now you can imagine these are four different projects going in different areas, serving different purposes, but none of them are holistic in nature that can really remove the inefficiencies. That's because, in a rating, there is a intelligence that is required to be fed by that layer into the decision making. That is something siloed, totally off on where the underwriters and the rating analysts use. In the second one, there is the plan sponsor intake. There is a conversion that happens, and then you are keying in all those data elements. Again, could have been done along with the sale process itself. And the third one, which is the whenever there is a payer that is switching, the experience of the payer is very, very critical. And here I'm taking almost 6 to 8 weeks just off of once they give me the data and going into a black hole. And last one, which is more cloud to on-prem integration, because of the siloed data elements and how they are structured, the success rate of the automation is very, very low. So moving on to the next slide, and this is where I think the platform-centric approach comes in. And as I said, I picked a very, very ignored, if you will, from the business function perspective in a health plan, just to make the point. There is so much of inefficiencies where that could all be eliminated just by organizing the business process steps in a more meaningful way that is configured for how the health plan is organized. Their departments are organized such that they all touch one system to go through this completely. And in the process, because of the technology can allow us to do this, blend the probabilistic rules or decision making along with the deterministic, that can help in whether it is the recommendation engine while doing the product design, or the product configurator advising the sales executive what, based on the prior carrier data that was ingested in, what are the benefits that could help them, or if it's a renewal, then advise them based on the benefit utilization. How has been the benefit utilization last year? So, and then use the NLP and natural language generation technology to really create that SBC documents or EOC documents that are required for the plan sponsors, as well as in certain cases, if you need to file this with the state, you are using the same document, and that document is generated on one source of truth. That is what was sold, that was what was agreed upon, and that was what was priced in. And when you configure and put it into for the claim system, there is no errors or mistakes that are causing to adjudication rates to go down, or the adjudication throughput to drop. So because the worst thing, the nightmare for a payer is after the sale is complete, they go through this process. Within a month, there are so many claims pending, and you have to manually go and edit all those claims. So that's kind of where the platform-centric approach can consolidate the business functions in a seamless way, depending on the roles or the individual personas that are going to be using these systems, can be configured such that depending on the data point, or depending on the data and the decision point, it can be routed and gotten the approval and processed, so that all the manual handshake that exists today, email-based communication, and if there are drops in the middle, until a plan sponsor asks, or a claim gets pended, gets escalated, no one knows what is happening. So that's kind of where the value of a platform-centric approach comes in, to eliminate the inefficiencies that exist in each of the these minor processes that exist in a larger business function called product configuration and plan sponsor onboarding. So I'll pause here and
Thank you so much, Vadi. Now we're going to dive into our panel discussion. So John, over to you to introduce the panel and get us started. John, you're on mute.
There we go. I'm sure you can hear me okay? Yep. Okay. So I'm going to let the panel kind of introduce themselves a little bit. I'm going to tee it up, and we'll have each member kind of give a little bit of a brief background. But first of all is Dr. Stephen Gerst, who's a former VP out of Columbia Healthcare. Steve, do you want to go?
Sure. I'm a physician by training, so I've got more of the clinical side to bring to this discussion. I've worked on both the health plan and the provider side during the course of my career, so I'm very familiar with both. Started off with Premier, with 4,000 hospitals, as you know, building the first provider-sponsored HMOs and PPOs. Then went into the insurance side of the business, putting together nationwide networks, PPOs, over 120,000 physicians and 1,200 hospitals. Then was with PricewaterhouseCoopers, and we helped develop some of the first Medicare Advantage plans and worked with hospitals to develop these integrated systems between hospitals and HMOs. And that's what we're seeing now. So I'm working with Avison as a fellow to try and further development of the integrated model as we move towards value-based care.
Okay, great. Thank you, Dr. Gerst. My name is John Walters. I'm a principal in the Avison healthcare practice. I have a specialty focus in platform and platform technology used to support the payer and provider markets. So let me go over to Vadi Raj, who is a senior healthcare consultant. He is in charge of the Helix development at Infosys, and is also head of strategic delivery. So Vadi Raj.
Thanks, John. Go by Vadi. I have played a variety of roles and been with Infosys consulting healthcare organizations in the past. In my current avatar, I head up the Infosys Helix. It's the next generation platform that we are building for addressing the inefficiencies I just talked about. Starting off with, we are focusing on the payer business processes, and then eventually we are going to expand that to include the provider and the PBM portion of the integration. So that's my quick introduction.
Great. And Josh Zalen is with us today. Josh has had a number of roles over his 20-year career in healthcare and healthcare technology. Most recently, Josh is with the Western New York Health Plan Independent Health. But Josh, maybe you could just give a brief hello.
Yeah, great to be here. Independent Health is a community-based health plan in Western New York. We're not for profit. We've got about 300,000 members across all lines of business. We also have our own PBM, and we have a small provider group that performs complex care at home.
Great. Thanks for being with us. Much appreciated. So I'd like to encourage everyone to send in a question if you have some. I know we didn't stop and pause after Vadiraj gave his little demo and architecture preview there. So if you have any questions related to that, we can pick those up. But just to get us started, Josh, I had a couple questions that I think would be quite relevant for you, since I know you're likely working on this stuff from a business perspective. I'm wondering about the use cases for analytics and artificial intelligence in terms of getting a better read and getting better visibility into your patient data. So for example, we hear a lot in the news about using social demographics of health and those attributes to help tailor treatments and things. Can you help us a little bit, since you're kind of in the trenches on this one, where are you with this kind of vision? And do you think the technology is starting to live up to its promise? I mean, are there real examples where you're starting to get better, analytic insights and things of that nature?
It's a great question. I think most health plans would say that there's a very small percentage of their member population that contributes the most to medical spend. But from a member perspective, or maybe it's better to call them patients, from a patient perspective, these are real issues for very sick people. And at Independent Health, being a community-based organization, we feel like it's our mission to improve the health and wellness of the local community. And to do that, we feel like we need to focus on the sickest of our members, those folks who've got multiple chronic conditions. And unfortunately, it's the nature of our community and probably many other communities across the US that there are specific social determinants of health that make it a big challenge for those people, specifically those people with multiple chronic conditions, to get the access to care that they need. So it's our job to figure out who those people are and how to reach out to them so that they get the access that's required, so that they get the learning that's required to improve their health. And that's where artificial intelligence can come in. Because when you've got a population of 300,000 members and each of them with multiple claims, and each of those claims could have multiple encounters, et cetera, the volume of data is significant. And it's critically important that we're able to quickly identify historically those members who join us and their information, and then members that we've had for some time, and be able to see exactly who those members are. And then when we have them, perhaps it's on the phone, be able to identify what is the appropriate best next action to take with those members.
Yeah, no, that makes a lot of sense. Just a follow-on question. So, Vadaraj, you heard, Josh and the business outcomes that they're chasing. As a technology a tech professional and somebody who's developing assets in the space, what do you see where's the promise for interoperability? These standards that should allow us to share data more effectively and more consistently across disparate systems, everything from medical records, data repositories to claims processing systems. So kind of my question for you in the context of Josh's statement is, where are we in terms of enabling data, more rich data sharing, and is interoperability as a standard, is that starting to have a positive impact on the technology stacks?
Yeah, no, I think great question, John. And I think Josh touched upon the focus from the clinical care perspective, right? And interoperability is, very, very much essential aspect for that to, be effective. And interoperability, since of course the mandate has been rolled out, and quite a few plans have, aligned and are complying with it from the minimalistic nature that is required by the law. But in true spirit of what it can do, the results are yet to be, seen, or at least the efforts to make it really using in treating the patient or the member, that is yet to happen. And it could start off from, let's say, when a Medicare member switches from one plan to the other. Of course, today they can carry over their data, but when they carry over the data, what do I do with that data, correct? So the HRAs that is required to kick off, plans still rely upon their age-old approach of using the HRAs to get the assessment rather than using the brought over data. So as a one point, and the genomic tests are becoming a lot more affordable, and in in next few years, it will be like any diagnostic test. But the issue there is the volume of data that comes with every test, and it gives wide variety of inputs that could be used. And so how relevant my targeted HRA would be versus using such a test, and is that data interoperable from, let's say, from where I do the test versus who is the caregiver versus the plan that sits in the middle of this. So those are the aspects, John, where the I would see platforms to be making investments and connecting the dots, which today are all done through siloed, care management, case management, disease management systems, where they expect data to be ingested into them to do anything meaningful with it.
Got it. Any questions from the audience or any feedback?
Not just yet, but I anticipate getting some a little bit later.
Okay. All right. Sounds good. So Josh, just another question for you. I mean, one of the things that we talk a lot about in terms of how technology can help in healthcare operations is the ability to be less reactive and more proactive. Now, when you look at, say, for example, when you look at the website of Independent Health, you see a number of things that are very wellness focused, things like, I noticed that you do a collaboration with the YMCA called Fitness in the Park. You have bike rides, wellness walks, a volunteer blood pressure monitoring program. I'm just curious, all these things that are designed to get out there and to promote the wellness of your patients, what kind of reaction have you seen, and what kind of participation are you getting in all these activities?
I'm so glad that you looked at that. Actually, maybe I'll start with just a little story. I went to one. I try to go to these events as much as I can. We had an event. It was actually a season of what we call Soccer for Success, where we offer free a free soccer league for elementary school students in underserved communities of Buffalo. And at the end of the season, we have a party for all of the attendees with their coaches right on the waterfront, the Lake Erie waterfront. There's playground there, free food, music. And I went to that final celebration and met with the parents of the elementary school students, and just the community appreciation to have something like this was truly unbelievable. A lot of these kids have no other opportunity to get out there and be in formal exercise, formal sports leagues or athletics. Don't have the opportunity to meet with the types of people who are their coaches for these events. And the parents are just so grateful, and you can see the kids and the impact that it makes on them, and the team building and team bonding. So I think community involvement can be a challenge if you're not part of the community. And so, I think that's a struggle for the national payers in particular, but for the community-based health plans, which are fairly common in New York State and in a few other states, I think our mission and our engagement with the community really makes a difference in community uptake on these activities. And so it's not just sending out a flyer or sending out an email, but people see us in the community. We wear our red shirts, which I don't have mine on right now. I probably should have worn it.
Yeah.
But they're bright red, and they say,
red shirt. Yeah, I saw that.
I am a red shirt, and we walk in the community with these shirts. People ask us questions. People talk to us about independent health. People talk to us about their needs, and we talk to them about what we have going on, and it makes a huge difference. And so it's that community connection. It's at a very, very personal level that makes a difference.
No, that's great to hear. And, sometimes it can be a little hard to track empirical evidence, linked to these types of activities and how is it helping you. But I think you brought up a few great examples, getting out there, getting the brand of your organization front and center to people, and then associating that with wellness activities, and then educating your members and your patients about exercise and activities that can be helpful to combating many of the chronic diseases we deal with today. Yeah, that's great. So, Dr. Gerst, one of the things that I wanted to ask you in this session, especially related to some of the things that Josh just talked about from a wellness perspective, is as we've seen, the kind of baby boomer effect into Medicare and the amount of focus that companies are having in the Medicare space, how are you seeing, this population in general? How are the needs of the Medicare population being met or not met, by the companies out there that are serving them today? Is there some kind of unique aspects that you think are critical to CMS programs and Medicare programs?
Yeah, absolutely. That's a good question, John. There's 63 million people covered under Medicare right now. And 37% of those have Medicare Advantage plans. So that's grown dramatically. And as the payers start taking more and more of control over the Medicare plans and the population gets older, they're starting to take a greater 360-degree view of the patient. And that's what they're trying to put together. So the incentives are built in now, and CMS continues to modify and incentivize the payers to work with the providers in order to maximize the outcomes or improve the outcome, total patient outcome. You know, prior to this, even though Medicare is the largest payer in the country, everything's been so siloed with the hospitals versus the insurance companies. Now we're bringing it all together around the patient, very patient-centric model. And you're putting together the infrastructure, you're trying to put together common data backbones and advanced analytics technologies. So as Josh mentioned, we can more quickly identify, especially chronic care patients as they could move towards demise. But on the other side, with you read about it every day, there's hospital staffing shortages, nursing, especially nursing staffing shortages everywhere. There's physician burnout. And so a lot of it is sort of shifting over towards the payer side to try and help control that patient. And also and the government is trying to incentivize the use of virtual care through AI. Obviously, we've talked about this many times, remote patient monitoring, telemedicine. The COVID pandemic obviously spurred a huch and rapid adoption of these virtual technologies such as telemedicine, remote patient monitoring. They've now added this past year, not only remote patient monitoring is now divided into remote physiologic monitoring, which is the devices, and the reimbursement has been increasing. This last year it went down just a little bit as adoption increased, but also remote therapeutic monitoring, and now remote chronic pain and chronic care management monitoring. And so there's reimbursement systems that have been developed, that are being developed for that. There's new codes, as a matter of fact, for 2023 proposed. For remote therapeutic monitoring, 4 new codes that has to deal primarily with respiratory and musculoskeletal symptoms and mental health issues. And so we're trying to put it all together. Obviously, you talked about social determinants of health. And a lot of those social determinants of health play into mental health roles, access, and the virtual nature of what you need to do to extend care into the community and tie it all together and have that data to avoid hospitalizations if possible and maximize the usage of staff.
John, we do have a question for Dr. Gerst in the chat.
Yeah.
Do you want me to read it?
Go ahead, please.
From a physician's perspective, how can these systems better inform you to provide better care for patients? Analytics. My physicians complain they have to spend too much time and money working with insurance companies.
Always a problem. That's a very good question. Yeah, so RPA, or repetitive process automation, is rapidly coming online. You've seen more and more companies offering these different segments of services. Primarily, it's to automate the routine tasks of prior authorization, billing, collections, appointments, scheduling, all those things that the staff currently is burdened by. And so there, many of these new technologies are gaining adoption rapidly, and they're also seeing much higher rates of revenue generation as a result of implementing some of these technologies. I think there's about 30% of the major hospital systems, mostly, that have been implementing these technologies. Some of the smaller rural hospitals are starting to implement and just being able to do more outreach to patients to gather the data, especially most of you, everybody's been to a physician's office, and you have to spend the first 15 minutes filling out paperwork. Well, if you can do that in advance, which is what most of these systems do, you can gather that data and then react to it before the patient ever gets there, and often start the pre-auth process to at least notify the payer. And the payers can then react to it automatically, because on that side, there's artificial intelligence, which is picking up so much of the routine types of diagnoses and what needs to occur prior to, during, and after the visit to speed the process. I see Vidra is nodding his head. Do you agree with that? Is that right?
Yeah, yeah.
That's part of your process, correct?
That's right. That's right. Yeah, yeah. And I think that was a good point, Dr. Gerst, in terms of the use of remote, the whole RPA in the journey of modernization has a huge role to play for the organizations, right? Because the whole digitalization requires the complete restacking your tech layer, and that can be expensive for smaller firms. And RPA is a good way to in the journey to start off with that. Actually, I agree.
Right. You also see a lot of use of chatbots, for example.
Chatbots, yes, yeah.
In the process.
Yeah, chatbots, and especially in the, of course, the experience is a lot more from the member experience, provider experience. There is quite obvious use cases, but more importantly, in the back end or the back office perspective, the whole, digitization of the SOPs, both from the, let's say, the provider billing processes versus the payers, application support, or the business process support. There's a very good use of chatbots, Dr. Gerst.
Right, and of course, and also in patient scheduling, that's a big issue now, because most of these systems allow the patients to schedule themselves.
Yeah.
And change their appointments if necessary. It doesn't tie up staff. They can do it online. If they have to change, it automatically drops out and it allows to put another patient in. And it takes these systems to become very efficient. And I think you can see rapid adoption across the industry on patient scheduling. Okay.
That's right. And I personally have found the text-based interaction, right, is very effective. There is no wait time, and you use pretty much the same technology to do that, but it is a lot more instantaneous. One. Second, you can use it to engage with the patients in a much more meaningful way. So even for the scheduling is a very good example where you put in a call and they send you a text. Rescheduling, if you need to, is a it works like a charm in text. Actually, I was pleasantly surprised when I tried that other day.
I might also suggest that when physicians are spending too much time and money with the insurance companies, the data may be able to, and I'm not sure which system it would be actually, but perhaps there's a way to identify within the data what precisely is causing, what precisely are those physicians spending time on with the insurance companies? Is it the same insurance company every time? Is it the same procedure every time? Because that could also inform where either perhaps there needs to be improved relations with that particular payer, or perhaps there's a process improvement on the physician side. I think that's the kind of data that might also help to answer that question.
Right, and there's another issue would be the EHR integrations. For a long time, the hospitals have kept their EHR data very separate, very siloed. And in addition to that, so many of the hospitals have had digital silos within departments. The Epic Cerner systems and all that are starting to bring that together. You'll see articles on the Cerner basically integration with Oracle. And that's one of their major focuses right now, is to optimize this interaction with patients. There was an announcement this morning about Amazon buying One Medical. And the first focus on that is to increase patient communication and patient engagement, so that they can maximize the revenue on the physician side and maximize efficiencies. Basically, start to re-engineer or rethink the way our system is done. You'll also see on Epic has just announced a lot of their work with interoperability. And as Epic then makes that data more accessible to the health plans, instead of keeping it separate, you can use the basic platforms or the digital platforms as we move to digital health to integrate that and make it much more efficient for the patient.
Excellent. Yeah. Great. Great discussion. So Josh, I had one more question kind of directed at you. And this was kind of related to the types of plans that you execute in your market. What I was wondering is, are you trending towards more plans that have higher degrees of risk? In other words, if little to no risk is, let's say, an administrative services only plan, and full risk is a Medicare Advantage plan, are you seeing any trend, or is it kind of staying the same in terms of the balance of your members, which are, say, at risk versus administratively focused?
We do have a Medicare Advantage plan. We have seen growth in our Medicare Advantage plan. Unfortunately, for the Western New York area, we are affected by by economic downturn. So as people leave the commercial line of business, we end up often seeing them either under our third-party administrator from a COBRA perspective, or we see them over on the could be individual plans, could be on the Medicare plan, depending on their age, could be even Medicaid. So I guess I'm not sure the best way to answer that, except to say that, we're constantly evaluating risk to the plan, so to speak.
Yeah.
But ultimately, because we are not for profit, our primary concern, really our only concern, is, are we doing what's right for the community as we evaluate basically our risk numbers.
Yeah, makes sense. So what I'd like to do with this last question, I'll kind of tee it up to each of our members of the panel, and then we'll have a little time left over for Q&A. But as we talked about, these platform and tech sessions, we initially focused on some of the automation, which can help with the administration of benefits. Could be enrollment, could be claims processing, could be adjudication logic, things like that. With this session, we're saying that one of the next challenges, other than operating administrative or automating administrative processes and operations, is how to optimize the experience for members and patients. So let me just tee that up and ask this question, and I'll start with Steve. As you see this trend towards movement towards patient experience as a focus, what are you seeing that are kind of good examples of that, and are you seeing gaps that are still big in the sector that would lead us to better patient experiences?
I think I'm seeing a lot of better patient experiences overall. As things go digital, they're more addressed towards that individual patient's needs, and especially, when you're talking about chronic illnesses, which is obviously the most important area that we're focused on right now. Well, a huge percentage of the population have at least one chronic disease. Once you get one, like diabetes, COPD, something along that nature, it tends to expand into multitude of chronic disorders. And so that, you know, a lot of people who have one end up having 3 or 4. And the technology now can pick that out and help prevent those types of indications through asking questions. You know, there's daily chatbots that come out on text. And some people talk about the frowny face. You know, how you doing today? Is it happy face or you know, frowny face or a really frowny face? And that sort of electronically triages the patients into the care management system that the hospitals and the payers are working on together. And I think you're going to see a lot more consolidation between hospitals or healthcare providers and payers to be able to more efficiently direct the care around chronic care patients, which is really what's costing the system the most money. And if you can address those issues, you can extend longevity of life and better quality of life for people.
Right. That's great. So Vadiraj, let me ask you the same question. I know you'll have a little different slant as opposed to Steve, who's a physician by training and has been involved in a lot of healthcare delivery. You're a technology company with a focus on building tech to help the sector. So as you see and you notice this turn towards patient engagement, you know, patient centricity, if you will, is that also impacting how you build applications and develop technology? How are you seeing the sort of a trend toward patient centricity impacting your roadmap?
Yeah, no, I think the patient centricity, John, one of the things that we have started to focus on just as we speak is the whole payment process in healthcare. You know, when you walk in and get treated, you have no idea how much you are going to be paying at the end of it. And I would love to have that retail-like experience as I walk out of the doctor's office. I want to be settling my accounts because, you know, personally, I go through this, you know, for all my 4 members in my family, each have different doctors. And if I keep getting these bills separately and I have to write the check and put the stamp in a very, very traditional way, I don't even pay my utility bills that way these days. But healthcare providers, I still pay that way. And, you know, there has to be a better way to do it, one. So there are 2 parts to it. One, how better or how good we can become in estimating the cost for a procedure or for a treatment. Second, how can I build the payment process such that it is seamless, and if I'm having an HSA account, it should take from the HSA account. If I have my you know, credit card, and like, you know, retail has done a phenomenal job in that, and we just need to borrow the idea from there in implementing it. So that's where I think it has a huge gain as an industry, as well as the experience. And you know, Josh was talking about the Medicaid patients earlier, right? You know, Medicare, because you know, they are all you know, go by the reimbursements they get. And unless we have a very nice way of teeing this up, it becomes in itself a stressful thing, causing so many other health issues for those, you know, age 65 and above. So I think that is where, in my opinion, John, we are focusing on, and I'm sure industry is focusing on as well.
So great, Vadiraj, thank you so much. So Josh, just a follow-up question. I'll kind of frame the same question to you. I mean, you talked a lot about some of the wellness events that you're doing and getting out in the community and branding and things. Are you also seeing the technology side of that? I mean, let me ask the question in 2 parts. First of all, would you agree that patient experience is a main category of focus? And then what kind of things are you guys doing from a technology implementation perspective to sort of focus on experience versus, efficient operations?
We have a huge investment on the digital experience for our members. It's a major component of our strategy. And it applies probably to a good 80% of our member population. Interestingly, that 80% tends to also be the healthier 80% of our member population.
Right.
But, who's healthy now may not be so healthy in 10 years. And so it's sort of a long-term view that if we can get those members engaged digitally now, they'll be engaged in the future. The other 20%, unfortunately, if we invest in our digital experience or digital technology without regards for that other 20%, the disparity, the health outcome disparity between that 20 and the other 80 increases. So we have to take that carefully.
Yeah, it's an interesting dynamic for sure. Social demographics of health have historically focused on a patient's background and, maybe income levels and access to care and things like that. But more and more, the social media footprint of an individual, you may have young, healthy people who are enthusiastic about communicating the plan over social media, but then you may need a different kind of outreach for Medicare Advantage social media. And, it might need to be more specific or more proactive rather than self-service and things. So I think that's an interesting perspective.
So John, we've got about 3 minutes.
Okay, great. Any questions from the audience, Andriana? Or?
There's one more. We'll need to make it a little quick. What have been the most helpful technologies, cloud, AI, et cetera, in the shift to more telehealth care?
Yeah, Josh, maybe you could take that one. I mean, are you seeing a substantial shift to remote encounters and telemedicine, or is it sort of a gradual adoption? What are you seeing?
Well, of course, during the pandemic, we saw that shift. It didn't help that in our state, New York State had regulations that basically did not support telemedicine. Those were waived during the pandemic and they continue to be addressed. But like the reimbursements, for example, aren't really well articulated and don't truly align with telemedicine. So we believe that, and the physicians that we work with believe that could be a very important component of how care is delivered. But the state needs to catch up. That's basically the best answer.
Well, yeah, that's a good point. We didn't get around to it. I had a couple of questions on compliance and things of that nature, which I know have been different on a state-by-state basis around telemedicine. But I know we're just about out of time, Andriana. So if there's any more quick questions, or
I think, John, if you want to do a quick wrap up.
Yeah. I mean, this is a pretty meaty topic that we've bitten off here. I think you can approach it from a number of different ways, but I like this multi-stage idea, of categorizing technology enablers into things that can automate and help efficiently process versus things which are focused on wellness and patient centricity and the patient experience as a next step. In our next and final topic around platforms, we'll be discussing how platforms can support a health plan's growth initiatives, whether that be moving in and out of different kinds of plans, commercial versus government, or moving from single geographies into regional or super regional geographies. So that'll be the last topic in this series. And I hope that you guys can attend that one as well. So that's it for me, Andriana.
All right. Well, thank you to all of today's speakers and participants. We hope you enjoyed the session as much as we did. And a special thank you to Infosys and Body for joining us as a partner for this event. A replay of today's digital forum will be available shortly on our event page and emailed to all attendees. Thank you again for joining, and we look forward to seeing you at part 3 of Avasant and Infosys Healthcare Platforms Digital Forum. Cheers, everyone.